Hello and welcome. My name is Ashley Hawes, and I'm the Director for Consumer Information at Benjamin Rose Institute on Aging. Thank you for joining us today for a conversation on healthy aging and naturally occurring retirement communities presented in partnership with the Elder Justice Coalition. This webinar will be recorded. You may submit a question at any time using either the Q&A or the chat feature at the bottom of your screen. We do have staff monitoring to convey your questions to our presenters and to answer any technical questions you may have. You can turn on captions by selecting live transcript, which is the button with two C's at the bottom of the screen. Today, we have the pleasure of hearing from two experts in the field to give us perspective on naturally occurring retirement communities and healthy aging. First, we will hear from Bob Blancato, president of Matz Blancato and Associates, and the national coordinator of the Elder Justice Coalition. Afterward, we will hear from Orion Bell, president and CEO of Benjamin Rose. Orion joined Benjamin Rose in 2019 with more than 30 years in leadership experience in not-for-profit management. Prior to joining Benjamin Rose, he served as president and chief executive officer of CICOA Aging and In-Home Solutions, which is the largest of Indiana's 16 area agencies on aging. I'm now going to turn it over to Bob Blancato, who again is a national coordinator of the bipartisan 3,000 member Elder Justice Coalition, who's going to get us started. Bob?
Thank you very much, Ashley. And I will go to my slides in a second here. First of all, it's great to be here, and it's a pleasure for the Elder Justice Coalition to co-host this webinar with Benjamin Rose. And my contact information is at the bottom of this slide. Should there be questions at the end that you don't have time for, you want to email me. So let's go to the first slide. So it's my pleasure to do this today with the Benjamin Rose Institute on Aging. Our topics today are very important and timely. Mine's going to be on healthy aging, and Orion's will be on naturally occurring retirement communities. Healthy aging's relevance grows as the number of older adults grows in this nation. And healthy aging actually has underpinned many federal aging programs for over 60 years. One example, we all know the Older Americans Act has one of its goals to promote the independence of older adults, which is very connected to healthy aging. Next slide. So what is healthy aging? There's definitions running from the national groups to international groups. World Health Organization says it's the process of developing and maintaining the functional ability that enables well-being in old age, including the ability to meet basic needs, be mobile, build and maintain relationships, learn, grow, and make decisions, and contribute to society. Our own Department of Health and Human Services says healthy aging is adopting healthy habits and behaviors, staying involved in your community, using preventative services, managing health conditions, and understanding your medications that can contribute to a meaningful life. Next slide. So now we're in the 20s, the 2020s versus the roaring 20s, and we're in the decade of healthy aging. And the United Nations General Assembly proclaimed this to be the decade of healthy aging, an initiative to improve the lives of older people, their families, and the communities in which they live. It adheres to the guiding principles of a 2030 agenda and has 4 action areas in the decade of healthy aging: to change how we think, feel, and act toward age and aging, ensure that communities foster the abilities of older people, deliver person-centered integrated care and primary healthy services responsive to older people, and to provide access to long-term care for older adults who need it. Next slide. And of course, co-sponsoring with Benjamin Rose is great because they make constant contributions to the field of healthy aging. Their mission says it, and their programs do it, including the Rose Centers for Aging Well, that have delivered almost over 243,000 meals to homebound older adults, and 47,000 medically tailored meals for older adults, which is very important and emerging as a very popular area and important area. They have a senior companion program. They offer health and wellness workshops. So they are actually, walking the walk when we talk about this topic. Now, healthy aging is getting a lot of attention in Washington. I participated several months ago in a bipartisan roundtable on healthy aging called by Chairman Bernie Sanders of the Senate Health, Education, and Labor Committee. And a number of senators, as you can see, showed up at that healthy aging roundtable. And the discussion was centered around efforts to promote healthy aging. And it led to really some new endorsements and stronger support for the Older Americans Act, which people now see as being crucial to healthy aging in place programs. And then this past June, Secretary Becerra of the Department of Health and Human Services delegated to the Administration for Community Living to run and administer the operations of a new interagency coordinating committee on healthy aging and age-friendly communities, which promises to be very important, do very important work in the coming months. Next slide. In September of last year, the first White House Conference on Hunger, Nutrition, and Health was held, first one since 1969. Its two goals were to end hunger and promote better nutrition by 2030, both critical to healthy aging. I was proud to participate in it, but what I liked the most about it was it solidified the nexus between nutrition and healthy aging. It produced an ongoing national strategy which includes a call for more funding for older adult nutrition programs, but also greater support for programs like I just talked about that Benjamin Rose already does about food as medicine, and a better understanding as a nation of the difference between good and bad nutrition and the consequences. Next slide. Now, some of the federal programs for healthy aging, let's talk about the Older Americans Act, because it has many programs geared toward healthy aging throughout its 7 titles. The largest program in the Act, as we know, is the nutrition program, which provides meals as well as nutrition education and counseling. Title 3B, providing funding for supportive services from senior centers to transportation to legal services, all intended to keep older adults independent and healthier. Information and referral services, which direct older adults to healthy aging programs, such as evidence-based fitness programs, the SNAP program, the Senior Farmers Market program, and a whole range of Medicare preventative health services, and the Welcome to Medicare exam. Next slide. Other programs for healthy aging include the National Family Caregiver Support Program that prepares and trains family caregivers, which allows the person receiving care to get the care in a home setting, which promotes better physical and mental health. The Senior Employment Community Service Employment Program, providing low-income older adults with part-time community service employment, which keeps them engaged and active. Title VI of the Older Americans Act provides resources to help older Native Americans maintain their health and independence. And clearly a critical feature of the Older Americans Act is the important role it plays in combating isolation and loneliness, which is the antithesis of healthy aging. Next slide. More federal programs are addressing healthy aging. 2 examples. Medicare today provides more funding for preventative services than any time in its history, including a Welcome to Medicare service and an annual wellness check. And starting more than 5 years ago, Medicaid now spends more on home and community-based services than institutional care. Medicare Advantage, which has been reimbursing for non-medical supplemental services for a number of years for its members, including nutrition and transportation, which helps maintain their health. And now states are moving towards statewide managed care, and it will be very interesting to see how healthy aging programs are impacted by this transition. Next slide. As many as 24 states now have adopted or are in the process of adopting master or multi-sector plans on aging. Central to many of these efforts are about supporting those programs and services that allow individuals to age well in that particular state. Support for community-based services is a key element in a number of these plans, and an overall recognition of promoting healthy aging as a key goal. And as you can see on the next map, these are the places where this activity is going on. The brighter colors are where, like in Massachusetts and New York and California, are particularly involved, and there are more to come. And I suspect this is a trend we will watch going forward. Next slide. Now, we must also address some of the challenges to healthy aging. And we must be strong in addressing these issues and address them and not be inhibited in talking about it. I'll talk about 4 in particular: elder abuse, neglect, and exploitation, malnutrition, falls, and social isolation and loneliness. Our Elder Justice Coalition recognizes a link between these issues. We are working to gain passage of the Elder Justice Reauthorization and Modernization Act, which provides more funding for adult protective services and the Long-Term Care Ombudsman Program, increases staffing in nursing homes, and will fund a new grant program for area agencies on aging to help combat isolation and loneliness. And I'll leave this slide up for a minute, just to tell you more information. You can see this, and I guess these slides will be made available by Benjamin Rose. But it's a pleasure to be able to talk about this subject. It's something we all work in, Orion and myself and many people in the Aging Network. And it is now my pleasure to turn the program over to the President and CEO of Benjamin Rose Institute on Aging, Orion Bell. Orion?
Thank you, Bob. So as Bob said, the conversations about livable communities and NORCs, we'll talk about here in a little bit more detail, all fit within this larger conversation of healthy aging and health promotion and activities in this space. So there's a great tie-in within these topics, and thinking about this as a holistic approach to thinking about aging and aging in place. So I want to begin a little bit and talk about a concept of something called a NORC, a naturally occurring retirement community. And if we can go to the next slide. Now I'm going to begin a conversation about NORCs to say that part of the development of NORCs was out of some federal funding that was in place now about 20 to 25 years ago that this actually began in the late 90s. And the specific funding mechanism for this is not something that is open today. So if you were looking for a federal grant application to start a NORC, there's not a box to check to apply for that particular source of funding. But even though that part of the program that helped launch some of this conversation and discussion in the mid-90s is not there, it's still an important part of the conversation about livability and how people can successfully age in place. And it's a very useful model and a useful tool for thinking about planning and service delivery in your programs. So a lot of opportunity in place there, as you'll see when we go through the conversation. So some of the considerations of a NORC is that it's an area where, and the formal definition of is that 40% of the residents in the area are age 65 and older. And the significant part of this is it's residents who have aged in place. So it's not a planned community. It's not a continuum of care. It's not a purpose-built senior high-rise building or something to that effect. It's an area where just through the normal pattern of people moving into an area and establishing their homes there, the people have aged in place. They have grown older. But it's also an opportunity to look at these areas as places for coordinated services, for the amenities, ways to approach the public programs and things that can enhance the quality of life for older adults. There's also some other considerations that are important when thinking about a NORC or a naturally occurring retirement community, and the community part is really important. It should be a compact geographic area. It should be an area that you can identify as a place, whether you were talking about it as a naturally occurring retirement community or not. It would be identifiable neighborhoods, boundaries that are recognized within the community. There's some sense of place there because this is, after all, a place where people have lived for a while. They've aged in place in this area. And so part of what makes a NORC work is just sort of the features of a neighborhood. If it is something that has an area that has a business association, if it's an area with a community festival, maybe it's the boundary of the elementary school district or the parish community around it, but it has an identification as a place. And it's also important that there's the opportunities for economic development or neighborhood revitalization or other initiatives that are not specifically connected to aging. Because when we think about these neighborhoods and you're thinking about places where people have aged in place, so by definition, we're often thinking about an older neighborhood. In a community like Cleveland, we're often thinking about what we would refer to as the inner ring suburbs, some of the older residential areas of the community. And very often these are places, particularly in older cities or larger communities, where there's some discussion about neighborhood revitalization or neighborhood redevelopment that would mesh with this and be a part of this conversation about a retirement community. So go on to the next slide, please. So a little bit of history about NORCs. They were funded through a federal housing special purpose grant. So this was funding that was available through HUD. And the NORC projects were identified in a lot of places around the country. And what they had in common was, aside from the fact that they had a large percentage of older adult residents in the communities, is there was a focus on resource development and service coordination for the residents in those spaces. And so Cleveland and many other communities had formally recognized NORCs that were established as a part of this process. If we go to the next slide, and I'm going to just talk a little bit about that there were approximately 3 million households distributed in the U.S. across about 10,200 NORCs around the country. And on average, there were about 307 households in the space. So again, compact geography, places that people would recognize, a neighborhood you would know, a landmark in the area you would recognize, but something that provided some cohesion for that space. So go to the next slide. I want to talk a little bit about a specific NORC that exists here in Cleveland. And as I begin this, I just want to give a shout out to a colleague in aging in our community, Georgia Annensberger. Dr. Annensberger was a staff member at the Benjamin Rose Institute on Aging. She later went on to Cleveland State University, and so I'm going to be reading off of some of her homework and some work that she had done in working with Community Options, which was the NORC here in the Cleveland area. So let's talk about Community Options. Let's go to the next slide. Community Options was established as a program through the Jewish Community Federation here in Cleveland. And it was established as a partnership between landlords and tenants in some affordable housing, high-rise buildings in the community here in the Cleveland area. It was community organizing is the concept around this, so that the residents were involved in the development of the design and the conversations and the things that were important to be included as amenities in this particular NORC, and a real focus around a place to call home. We go to the next slide. And just to give you an idea, if you're not familiar with the greater Cleveland area, these are areas that are largely in the eastern portion of Cuyahoga County. Part of this is within the city of Cleveland, but there's a lot of small cities in Cleveland, and so University Heights, Cleveland Heights, some of these areas that were a part of some of this, but places where there were affordable housing high rises that were not necessarily originally built to be apartments for older adults, but the population that lives in the buildings was older. Going to the next slide, a little bit about the participation in the building. So about 79% of the residents in this community were female. A little over half were widowed. So many of them living alone. The median age of the participants in the program is about 83 years of age. And on average, the folks that lived in these particular buildings had lived there for 8 years or more. About half of them had rated their health as good, and a little over 2/3 would say that they were mostly satisfied with their lives. So this was not a assisted living or a skilled care community. This is entirely comprised of independent living residents in the space, and so just sort of identifying the folks that were part of a naturally occurring retirement community. Again, not a healthcare setting. Not a place that people went to because of amenities, an area that they had aged into that space. So a little bit. So what did they do in programming? So some of the most popular elements of the programming that was provided in the research that Georgia did was that, as people identified the most popular or the things they most frequently used. There were regular educational luncheons, social gatherings, just social outings that were built around lunchtime programs, and about 60% of the participants, residents in the community, participated in those. equivalent to that was that there was a newsletter that was distributed, and most people identified that as something else that was very important to them. So it was a social connection. It was an opportunity to find out what was going on in the area, some entertainment or some activity that was pulled from that. But those were the two most popular elements of what was offered as resources or services within the NORC, followed by recreational and educational activities. So a lot of focus around either things that could be brought in for activities for people to participate in, or outings where they would plan trips or activities where they would go other places. Smaller percentages of people, about a third, took place in tours, opportunities to volunteer, because a big part of the message in this was this is a self-help effort. These are opportunities for people to participate in the community, not only in utilizing services, but also in providing them for their neighbors. And then only about a quarter of the population where they saw the NORC as the way that they actively were able to arrange for health and social services. So some of the sort of the traditional things that we might associate in terms of service coordination or activities that would be done by an organization like Benjamin Rose. So it was there. It was used by a percentage of the population, but that was not the primary draw of the program. And I would say that, just as an example, in the community I lived in before moving to Cleveland, we had a NORC in the greater Indianapolis area. And it was established in part of the community enough that if you looked at a house that was for sale in that neighborhood, and the realtors would always leave you the list of amenities about, shopping or churches that were nearby or other kind of amenities in the community, they would list the fact that it was a NORC as one of the amenities of the community that they would promote to other people as folks looked at the community to move in. So some of the benefits that people saw from this primarily was they saw this as something that contributed to their ability to continue living in their apartment. It promoted their independence. It let them stay in a neighborhood that they wanted to be in. And 80% or more said that it was effective in doing that. It promoted more contact with their neighbors. Again, a lot of that, the social connectivity, the newsletter, other kind of information that was there. Better access to help when they needed it. And then the other one that was sort of in the top tier of the responses to this was an opportunity to participate, to help your neighbors in some way. So very much is an element of this is a conversation about not only that there's services available for me to use, there's also opportunities for me to give back, to participate. And this was a part of establishing that sense of community and participation in that space. So in looking at that, what is it that makes a NORC work? It's more than just a gathering of people of a certain age. What makes it work? And Georgia, in some of her work around this, she identified the most critical part of a NORC, the thing that was most necessary for it to be effective, was there had to be a sense that there were access to services and activities as they were needed, but also as they were desired. So it was not just the things you had to have, but the things you wanted to have, the things you would choose to do, the opportunities to participate. And so, we have a lot of conversations about person-centered planning, about opportunities for choice and selection. And this is very much borne out in this idea about NORCs and effective opportunities in a NORC, is that a big part of it is it's the things the residents want to do, the things that they think are important, the things that they can access, and when they need them. So there's an availability, an option, a choice, a selection, but also the timing of things when they can be there. A second, go to the next slide. Another thing that was very important for these to be effective is that there's a sense of social networking. This is an area that people would identify with because they had been there a while. They were connected to their neighbors. There were ties to other community entities, other community organizations, maybe the reason why they moved into the area in the first place. But there was a strong sense of social connectedness and social networking. And again, today, as we think about how to address social isolation, these were opportunities on a very informal basis to address some of the challenges of social connectedness, addressing social isolation, stronger sense of community identity, that were all part of people feeling healthier, better about their lives, and more content with the situations that they found themselves living in. So that's a real NORC, right? That's one that was formally recognized. It qualified for the federal funding and had the NORC in the environment. And I want to talk about a little different situation, and begin this with a story. So the Larchmere neighborhood, which is the neighborhood where the Benjamin Rose headquarters sits, is it's a community. It's in the city of Cleveland. It's right on the edge of Shaker Heights and Cleveland Heights. It's not terribly far from Case Western University and the University Circle space, but it is very much an identified neighborhood that has been there. And one of our longtime board members at Benjamin Rose, Patricia Frudig, who is a resident of the Larchmere area and an attorney by profession, had long advocated, as good board members will do, had advocated for this idea of, does the Larchmere area qualify as a NORC? Can we pursue the opportunity to think about services and think about the residents and think about the community as a NORC, a naturally occurring retirement community? So go to the next slide. So a little bit about Larchmere. It's a neighborhood in the Cleveland area, what's known as the Buckeye Shaker Planning District. I know the zip code map may not mean much to you if you don't live in the area, but basically it's an area that's bound by Martin Luther King Boulevard and Fair Hill Road and Larchmere in the Shaker Square area. There's a few challenges in thinking about Larchmere, because even though it's an identifiable area, there are signs that say "Welcome to Larchmere." There's an active business district. There's a tremendous porch fest, these music festivals. We have live music on people's porches in the summertime. There's a farmers market, a lot of other kind of things. There's definitely a sense of community in the space. But some of the challenges is not everybody's definition of that is the same. So it includes parts of the jurisdiction in the city of Cleveland, but it's also partly in Shaker Heights, which is a city adjacent. And if you ask some people, it even includes part of the Cleveland Heights area, which is another small city within Cuyahoga County. It's served by two different school districts. It's part of the Shaker Heights School District, but also parts of it are within the Cleveland Metropolitan School District. There's also a community development corporation, Burton Bell Carr Development, that works in the area that administers some of the economic development and housing development and neighborhood revitalization dollars that are available in Cleveland. But it's an older neighborhood. Many of the houses were built early in the 20th century. And the business district and the identification of it, it's been in place for some time. So as we started to think about the NORC and thinking about those determinations that would make it officially qualify as a naturally occurring retirement community, we engaged with our friends at the Center for Community Solutions to help us do some data diving and looking at the 2020 census data and exploring whether or not we thought we met the criteria that 40% of the population that was ages 60 and older in the community. So when we asked the question about is Larchmere a NORC, there were parts of the question that if we were just going purely on the technical definition, the answer would be no. It turns out that even though our perception of the neighborhood was that it had a lot of older residents, in truth, only about 20% of the total population of that Larchmere area were people aged 65 and older. And there were some reasons for that. And we'll look at those in just a little more detail here in just a second. But one of the things about it was, if you looked at the home ownership in the neighborhood, very much in the areas where the housing was the residential owner-occupied family-owned housing, or the single-family rented housing in the space, there was a larger percentage of that population that was older. But there's also a lot of apartment buildings, a lot of the area where the tenants are students at one of the universities in the area. It's an area where there's a lot of the immigrant population resides in the Cleveland area because of the affordability. So people that are new to the country there, and there's some subsidized housing and some projects in that space that are targeted at affordability, which drew a lot of younger residents into the area too. So on this particular count, our perception of the community as aging in place didn't quite match up for that. However, we did have a large population of people that were aging in place, large numbers of people, even if it wasn't the 40%. And we also saw there was a lot of opportunity for coordination with a variety of other programs and services and things that we could do to leverage resources to build on the livability of the community. So if we go to the next slide there, thank you. So when we looked at the total census map and the census plots in that area, we broke those down a little further and we looked at block groups. And so within you have a census tract, which is the full map that you see there. And then the Census Bureau will break those into smaller census block groups, which is the smallest data set that they'll break out for a particular community to identify population demographic information, like median income or household size or age, racial demographics and those kind of things. But it's a smaller component, and typically a block group will have between 600 to 3,000 people in it. So if the whole of Larchmere wasn't a NORC, were there parts of it that were? And so this was where the Center for Community Solutions was helpful to us. To go on the next slide. And so we identified a couple of the block groups in the area, and you see one of these in red here, where that percentage was higher. It was 30% or more, approaching 40% in one of these. And so they were two adjoining block groups within the larger Larchmere footprint. And so again, as you think about the typical NORC or the typical size of that, we were driving into more of that definition of where that would be. So we'll look at a couple of these block groups. Go to the next slide. So one of these, there were about 400 individuals in the area that were age 65 and older. It was, and about almost 84% of this population lived alone. And over 3/4 of the population were people living at or below poverty. And a lot of this population was not living in subsidized housing. They're in a home that they've been in for a very long time, but they're low income. And then the next block group, again, about 450 people, 3/4 people living alone, large majority female. But this group is not quite as low income as the other, but still over half of the population identified in this block were living at or below poverty. And so we have this cluster, these couple of neighborhoods that we saw. Well, that's where our focus might be in terms of looking at the residential services in the space. The advantage we had in looking at that is because we weren't applying for a federal grant, right? So we weren't approaching this in terms of the eligibility standard or the requirement, but we could look at the services or the strategy or the amenities that you would use in developing a approach of a naturally occurring retirement community. And you could do that free of the constraint of the rules, of the formal rules of the NORC. So part of the conversation we would have with folks in the community or approaching the city council members or others would be, says, we're not coming to you looking for funding for something at this point, right? We're not coming to you with a grant application in hand. This is a way for us to think about how we can provide services and supports for the residents in the community. And so as we've looked at community assets in the space, one of the things that this area, this Larchmere area has in abundance is some good community partners to work with. I already mentioned the Benjamin Rose Institute on Aging is a resident of this neighborhood. Fairhill Partners, which is another nonprofit that serves older adults, is across the parking lot from us. They're our next door neighbor, and they provide a variety of supports and services for older adults in the neighborhood. It's one of the locations that we have as a congregate meal site for Benjamin Rose, but they also have a number of other services that they offer for older adults, including health promotion activities. They are a distribution site for the local food bank. They operate kinship care programs and some short-term housing and a variety of other services, but all built around addressing the needs of older adults. They also have a number of tenants on their property that are also human service providers, service delivery programs. Many of those are also focused on the needs of older adults. And I mentioned we're in the Burton Bell Carr CDC in that development district. So there is a strong community development agency that's looking at economic development, neighborhood revitalization, business development in the space. And so this is part of their footprint as well. There's a less formal project, the Shaker Area Development, that also it's a membership group that looks at business promotion and promotion of the area and the development in that space. There's a community association, which is the residents that live in the Larchmere area. Again, it's a very identifiable neighborhood. There's membership in that group and very active. There's a Larchmere Merchants Association because there is a business district in the area. And the couple of city council wards that are most of the area that would be identified in the Larchmere space with two very active council members who hold regular resident meetings and do a lot of promotion in the community in the space as well. So these were all tools to work with in thinking about being able to develop a model for this. So the next thing we looked at was just thinking about what are some of the amenities of the space. And we had the good fortune that there have been a couple of recent community surveys, community studies done in the space that while they were not specific to just those two block groups that we were looking at, they were specific to the area and they did include the business district in the general area we were looking at. And so some of the features of the community that are already there, it was a very walkable area. It's an older neighborhood. There's a lot of sidewalks. The business district that is smaller shops, with sidewalk access and street parking. And so there was good public transit relative to the larger community. It was more walkable than the larger community may be. And it also had some other public amenities. There's the Rockefeller Park and the Arthur Woods Park that are a couple of large park spaces that are nearby that residents can take advantage of. And so this information came from a walk score result that you can look at online and actually look up the zip code and see the information for this. So go on the next slide, please. So the other thing that was happening, sort of fortuitous in the space, was that the city of Cleveland and Cuyahoga County have both undertaken livability studies using the AARP livability index models. And so there's a livability score for 44120, which is the zip code that includes Larchmere and a larger footprint for that. And so it's actually an area that has a better than average score for the Cleveland area for the overall livability of the space. And there are, there are resources that are there. There's access to public transit. So there's a variety of services that are currently in place. That doesn't mean that they're optimized for everybody's benefit, but as a sort of a building block or a place to start, there's actually a lot to work with in the area. There's already a lot of resources in place and a lot of opportunity to develop some of these conversations more fully. Next slide, again, mentioned that the timing of some of this was helpful because the AARP livability index had just been updated. So in 2022, as the county focused on livability and its effort, so the city had done City of Cleveland had been involved in the development of this assessment years earlier. Cuyahoga County then does another one. So we had a couple of recent targets in terms of looking at these amenities or resources or assets of the community that looked at things that would be important to the residents: the quality of the housing stock, the neighborhoods, things like public safety and public transit, opportunities for engagement, the quality of the environment, so that the area actually looks pretty good in that space. There would be something to work with. So going to the next slide. And so I think this is one of the places where we would depart perhaps a little bit from the traditional NORC conversation. But I'm going to make the argument that this is a good thing in this case, because it gave us an opportunity to connect with some other community initiatives. So when Cuyahoga County launched its Livable Cuyahoga initiative, they did not identify it as age-friendly. Now, it's the same resource. It's still the AARP livability study, but they were intentional about calling it Livable Cuyahoga County. And the Age-Friendly Cleveland program is, it's very consistent with that. We're looking at the same scorecard, we're looking at the same metrics, and we can see the benefit of some changes over time in terms of the activity there. And so as we thought about this model, so we have the benefit of some neighborhood interest in doing this. We have the benefit of a robust community assessment that was just completed. There was even a focus group that targeted participants in this neighborhood and asking about features or amenities of the community that they were interested in. So on to the next slide. There's also a couple of other projects that are not the same as a NORC, but they're similar enough. And if we're not tethered to the requirements of fulfilling a particular grant, and we can think about what do we learn from the various elements. And so in our community and in the Cleveland area, there are a couple of villages concepts. And villages, if you're not familiar with them, these would be a membership based opportunity, again, targeting a specific geography in an area, aimed at amenities and services for older adults that are built around the notion of volunteerism and participation from residents in the community, very much volunteer-driven, volunteer-led. And there's a couple of these that exist today in the Cleveland area. One, the Village in the Heights, which would be the area just east of where the Larchmere is. And then there's also a West Side Village concept, which is more of the neighborhoods to the west of the city, on the other side of the Cuyahoga River. So in addition to those programs that are aimed at older adults, there's also some other initiatives that are taking place in the community that are important to tie into. And I think that the thing to me that is one of the most important things to take away from this is that this does not have to just be a conversation about livability for the older resident, because the amenities and the features in the community that make it an attractive place, a livable place for the older adult, is the same thing that promotes livability for uh, parents with young children, new families starting out. There's a similar interest in those spaces. And these are not either or conversations. And there's a tendency sometimes in aging is that we spend a lot of time talking amongst ourselves. And I think we do that at our detriment. That these are conversations that are about the livability of the community overall, not something you pigeonhole because some of the participants are in their 70s and 80s. So other initiatives that are happening in the greater Cleveland area is that interest in what's called the Complete Streets coalitions. And Complete Streets is this notion that, that it's not that the community is not just built around the car traffic, that you're thinking about the walkability of an area, the walkability of a business district, things like crosswalks and street signage and adequate lighting in spaces and well-maintained pedestrian throughways. This is a big part of community development and neighborhood development and economic development and neighborhood revitalization in communities all over the country. And those are completely compatible with a conversation about what makes a community an effective place to be considered a naturally occurring retirement community. There's also a concept that the mayor of Cleveland, Justin Bibb, as he was running for office and as he was talking about things he wanted to try to accomplish in Cleveland, he talked about this idea of a 15-minute city. And this goal that wherever you lived in the city, that you would be no more than 15 minutes away from community amenities that promote livability, so that there would be a grocery store, there would be a public park, there would be access to libraries or other resources, and that nobody in the community would be more than 15 minutes away from those places. And again, this is not a specific aging initiative, but if you look at the list of things they want to do, it's very much compatible with this. So if we can go to the next slide. So what these projects all have in common, whether we're talking about a NORC or we're talking about complete streets or these other development efforts to promote the livability of space, they're conversations about the walkability of the area. They're conversations about access to services. They're opportunities for community engagement, opportunities for volunteering, opportunities for public safety conversations, and promoting the community awareness and participation and people feeling at ease in the area where they live. And these are not unique to an older adult population. And so as we think about the services and the programming, it gives us a way to think about these as larger conversations, that you can have a conversation about economic development and neighborhood revitalization and an age-friendly community all at the same time. And they're not either or choices. They're not incompatible with each other in terms of what promotes the livability of the communities. If the only thing you leave off the conversation is age, everything else that people want is consistent. These are universal opportunities for people. So if we go into the next slide, so think, well, what are the implications of this? As we're exploring this opportunity to build on this notion of a NORC, and if it's not quite a NORC, but it's got elements of it, what does that mean? And how do we go about building out those resources? So we'll go to the next slide. So there's opportunities, again, because that's the focus of a NORC, is for service coordination and resource development, ways that you can raise awareness of what's available, knock down some of the barriers that people may have in terms of accessing a service, of knowing what's in their community, how to apply for it, how to participate in it, and for resource development. What are the things that people need to help them successfully age in place and be a part of that larger community. So as we think about service delivery and targeting of services, as an organization as Benjamin Rose, for us, that's thinking about approaching the service, thinking about the geography where it is, thinking about how we might provide services at a neighborhood level. So we operate Rose centers across Cuyahoga County, and these are neighborhood level programs. They operate in a Parks Department building, they operate in a public housing space, they operate in a community center or a Salvation Army site, but these are very much neighborhood level programs. And so as we think about approaching the conversation as the naturally occurring community, the geography of this and identification of the neighborhoods is a way for us to think about where should our next site be? Where should we try to focus our effort? Where can we have a critical mass? Because if we can be in a particular area, a particular neighborhood, then site selection or identification can have a significant impact in reducing transportation barriers or time limitations for things to participate. It may help us think about community partnerships that we should try to develop on a larger scale for those programs. So for example, as we think about one of the things that we do with our Rose Center locations or with the residents who live at the Margaret Wagner Apartments or some of the other community outreach they do, we do a lot of service coordination. And the service coordination is often, whether it's done by us or other organizations, service coordination is very often attached to a particular building. You know, the residents in an older adult affordable housing building, the participants in a Metro Housing Authority property, service coordination, any of the HUD 202 projects, the subsidized older adult housing, or the programs that are funded through the low-income housing tax funds, all of which we participate in. All of those have an element of them that are about service coordination and resource coordination for the residents in those buildings. Well, can you do service coordination just in the neighborhood? Not because people have moved into that building, but because there's a critical mass of a number of people there. And if it's a small enough footprint, is it someplace where you can, again, you achieve some critical mass where you can have a meaningful impact in that neighborhood because you've intentionally targeted some of your outreach, some of your social work, some of your educational programs to those particular places based on knowing these are where you have larger centers of population of older adults in the area. We look at opportunities also for collaboration with other organizations that we should be part of a conversation with economic development entities like the Burton Bell Carr Development District, because we both have an interest in the livability and the development in those neighborhoods. And if you look in those organizations and you look at who participates in the volunteer leadership in those districts, if you look who is the precinct captain in the voting districts, or if you look at the areas that have a neighborhood watch or other services, very often it's the older residents that are represented in those groups. It's the longtime homeowner who is committed to that neighborhood and in that space. And they're very much interested in the development of those programs going forward. I go to the block watch meetings or the block club meetings in my neighborhood where I live in Ohio City. And the majority of the participants in that are the older residents, the longtime residents of the community that are actively engaged in conversations about housing development, streets, public safety, communication with the councilman that is in that space. Very much representation there. So these are not either or choices. These are the folks that are there. This is an opportunity to develop those conversations. So that's what we've learned about the approach there. And we have a few minutes for questions. And so I'm going to turn the program back over to Ashley.
Thank you, Orion, and thank you, Bob, as well. As Orion mentioned, we do have time for a few questions. There have been some questions that have come in. As a reminder, if you would like to submit a question, you can submit it either using the Q&A feature or the chat option at the bottom of your screen. So our first question is, can a condo building that has gradually become primarily owned by 65 and older residents or owners, can that be considered a naturally occurring retirement community?
Absolutely. It's a lot of the NORCs that were identified were in, like, a lot of these were started like in places like New York City, where you had a rent controlled building and there were incentives for people to stay in place. Yeah, that's really the intent. It is an area where people have sort of naturally moved to the place where more of the residents are older.
Thank you. And you may not know the answer to this, but they also wanted to know, would it qualify at that point for federal funding?
So the funding question is probably a little trickier at that point. I think at this point, more than the specific federal funding, is that if you look at the aspects or the elements of a NORC, those become things that are good conversations to talk to other organizations about funding. Because a lot of this would be, economic development activity within a city or a city council district, or the work of a CDC in an area, because it's a way to frame that conversation around livability, public safety, economic development, revitalization. But think about it. Can you present it in those terms? That's probably a more attractive funding proposal in a lot of cases than just a specific, NORC activity, since that NORC project has kind of lived its useful life in terms of grant funding.
Thank you so much. And we probably have time for one or two more questions. So if you do have a question still, please feel free to go ahead and submit it, and we'll try to fit you in. So another attendee would like to know, how are programs like luncheons, newsletters, outings planned in those communities? And secondly, is there a paid coordinator with the sites, or do residents typically arrange their own programs and activities?
So a lot of it is the latter. So in the Larchmere area, so we can't take any credit for this. This is already there, right? There is a neighborhood newsletter that is produced by the residents in Larchmere. Now, Fairhill Partners, one of the organizations that's in this footprint, they provide a supplement to it every month, right? So, but it's not something that they publish. But a lot of this it's very grassroots. It's very much built around a community organizing model, just helping facilitate people being able to do that. That's what makes it sustainable. The challenge sometimes with grant funds is the grants end, and then what do you do? So the idea that you try to develop it from a grassroots level and provide some support for it. So, like for Benjamin Rose, as we look at those things, we don't see a lot of new funding in it, but it helps us have conversations about how do we deploy the resources that we have. Where do we focus in terms of our programming, our services, and our activities?
Thank you, Orion. And for the last question, I'm not sure if you're familiar with the statistic, but a participant wanted to know whether it's true that 30% of Cleveland will be compromised of 55 plus by the year 2025.
The way we've usually presented it is that there will be as many adults 60 and older as there will be school-aged children. And across the country, that's like by 2030, that's true across the nation. In parts of Northeast Ohio, it's already true. So if it's not quite there at 2025, we're headed that way, that we have a significant population of folks that are 60 and older.
Thank you. All right. So we want to thank you, Orion. Thank you, Bob, again for such great presentations. We really enjoyed learning more about healthy aging and the NORC communities, especially those that are here close to us um, locally in Ohio. And then we want to thank everyone for joining us today. In the chat, you will find a link for a webinar evaluation that we hope you will complete. Your feedback is important to us because it does help us improve our programming. So we hope that you'll consider completing that evaluation for us. So you know that your responses will be kept confidential. They will not identify you in any way. We also hope that you will join us for future events. Next Friday, September 8th, we will be hosting Cleveland State University's inaugural event for their Adult Development and Aging Speaker Series. It's going to feature Dr. Joe Gogler, editor-in-chief of the Gerontologist and director of Bold Public Health Center of Excellence on Dementia Caregiving. The conference is in person from 9 to 1 at Benjamin Rose Conference Center, which is 11890 Fair Hill Road in Cleveland. And then also on September 21st from 1 to 2, we will have a Zoom webinar on the Ohio Council for Cognitive Health's Dementia Inclusive Public Library Guide. It's going to feature the former Deputy Director of the Akron Summit Library, Barbara White. You can register for these and all other events on our website, which is www.benrose.org. There you can find more information about all of Benjamin Rose's research, services, and programs. Thank you for joining us today, and we hope that you have a great day.
Thanks.